otaferwa aha Tayari West.
Tayari West TV ekuretire program tochi kugumane tukumurikira ebiri kugenda mu ihangeri ebirumwe byo butegeki ebyamagara ebyo bwegese n'emiturane y'abantu n'ebindi nyamwingi on program eji buru wa kabiri nitukuretera abahangu kumurikira enshongezi twina amasiko nguhine tafarira hango eruturateke hakutwara ihangeri omumisho na nyomushuganisa wayo Assistant Inspector General of Police Hassan Kasim.
Immunization, a simple yet powerful tool that has saved millions of lives. In Uganda, routine immunization services have transformed communities, protecting children from deadly diseases and giving them a chance to thrive. But not everyone has been reached. This is the story of Uganda's routine immunization journey, a story of hope, resilience, and the impact on those who have benefited and those who have missed out.
Initially, we were confined to hospitals and health centers initially. But you could see that there were few health centers at that time. So there would be very long distances for people to come from their villages to go to these places. And that created actually a very difficult situation for us.
1978, when Uganda was certified as having eliminated smallpox. However, the upheavals in the country at the time led to setbacks in health services, including immunization. The turning point came in 1983 with the establishment of the Uganda National Expanded Program of Immunization. Under the leadership of His Excellency President Yoweri Kaguta Museveni, who revitalized the program in 1987. President Museveni became a steadfast champion of immunization, running communities and underscoring its critical importance.
There are 14 vaccines which are being given to the people. We started with 6, there are now 14. That's why you hear that some of the sicknesses have disappeared. Polio, tekyawulikika, kawari, smallpox is no longer heard of. Orunkusense, measles, no longer heard of. Or from what? From the line of Bona Bagemewe. Immunization for all.
Routine immunization is a cornerstone of public health in Uganda. For over 4 decades, the Uganda National Expanded Program on Immunization, UNEPI, has worked tirelessly to ensure that every child has access to life-saving vaccines at no cost. Today, vaccines protect children from diseases like polio, measles, pneumonia, and more.
Immunization has contributed immensely towards the reduction of diseases of children and the death of children. And indeed, these days it is difficult to find, it's not common to find young children dying unnecessarily in hospitals or in homes, because most of the diseases that used to affect them, which include pneumonia, which include diarrhea, which include measles, and all those are now vaccinated against. And so the diseases, the reason to go to hospital, the time spent by families in hospital, the resources that the families use in hospital, transport, buying medicines, staying in hospital, not working, all that has been affected by immunization.
In communities across Uganda, routine immunization has made a profound impact. Families no longer live in fear of vaccine-preventable diseases, and children are growing up healthy and strong.
We used to have lots of challenges with high disease burden. For example, if you went to most of our facilities, you'll find that most of the babies brought in were having diarrhea. But with the introduction of PCV10, we have managed to reduce the numbers.
Kuze tuwulira nti okugemesa abaana si kirungi nga batugamba bw'ogemesa omwana alemala amagulu, bw'ogemesa omwana tosobola kwebaka, musula mutudde, omwana akaaba nnyo, abaana balwala, abaana basesema, kwegamba nga batutiisa. Naye essaawa eno nze kati guno gwakubiri ng'owange mugemesa, naye sinnalaba buzibu bwonna bw'afuna kuba mulamu bulungi. Mpozi kano ka temperature akajja azini kali nomo kya bulijjo. Nze ngamba buli muzadde wenna ali eyo kyandibadde kikukakatako nnyo n'otwala omwana wo ne bamugema.
Despite the progress, some children still miss out on routine immunization. In remote and underserved communities, access to vaccines remains a challenge. For these families, the consequences can be devastating.
Last financial year, the infant mortality rate of Okono district was at 16 per thousand live births. And then the child mortality rate was at around 20 per thousand live births. All this is majorly attributed to immunization of these children.
Uganda is working hard to overcome barriers to immunization. From mobile outreach programs to community sensitization campaigns, health workers are going the extra mile to ensure no child is left behind.
The entire health sector has been supportive, right from the ministers and the entire administration. And of course the entire structure, looking at the local governments, the leaders of local governments, both administrative, technical, and then the political leaders at that level. The involvement of these leaders has been instrumental in mobilizing members of the public, but also in mobilizing support at national level, but of course also within the different local governments. The other critical pillar we have had in a country are the cultural institutions, the kings of different kingdoms. When we had challenges as a country, the king of Uganda kingdom came out openly to mobilize the public and to engage both parents and caretakers and guardians of children to embrace vaccination. The Nabagerek of Uganda, other leaders from other regions in Busoga, in Bunyoro, in Toro, and of course also other cultural leaders from other parts of the country. So they have been instrumental in their geographical areas, but of course also at national level.
So there is improved survival of children, but also children who receive immunization are much more healthier. They are able to fight off the rest of the other diseases. So we, as a ministry, is one of those key prevention strategies which we would want that the community should be able to embrace so that we can be able to do that. Routine immunization is central to Uganda public health strategy in that it's aligning with the national goals to reduce hospital admissions but also improve resilience against disease. So that even if you get the disease, it reduces hospitalization but also reduces the chances of death.
Through this partnership, Uganda could address critical health challenges, increase vaccine access, and reach underserved populations.
Over the years, the immunization program, with support from different partners, has built capacity that enables us to be able to effectively manage vaccines from the time they are dispatched from the manufacturers to the point they are received in the country, stored at the national medical stores, and distributed across the country to the different service delivery points to make sure that there are vaccines available to all the target populations, and ensuring that they are potent and safe and efficacious for vaccinating the different target groups.
Over these years, Uganda has been able to register significant growth, and one of them is in the financial contribution towards the procurement of vaccines. Before this work started, the government of Uganda was contributing about 7 billion a year, but at this point in time, and after a couple of negotiations and engagements, government was able to lift its contribution to 21 billion. That's a significant improvement, and we have seen significant gains. As a result of those funds, the country has been able to expand from providing only 6 vaccines to now coming to about 14.
Uganda's routine immunization journey is far from over, with new vaccines on the horizon like malaria vaccine and a commitment to reaching every child. Uganda is building a healthier future for all.
The contribution of immunization to Uganda's health outcomes is undeniable. Over the decades, we have seen a significant decline in child mortality rates over the past 2 decades, that is 2000 to 2022. Infant mortality dropped from 88 per 1,000 live births to 36 per 1,000 live births. Under 5 mortality has decreased from 155 per 1,000 live births to 52 per 1,000 live births. These achievements have been made possible by the steadfast support of our partners.
Currently, we are looking at what we call the National Immunization Strategic Plan, which is costed, and then they mobilize resources, and then they implement. Now, the other area WHO supports as far as routine is concerned is to ensure that the vaccines are pre-qualified. And pre-qualification looks at 3 components: safety, immunogenicity. What we basically mean is it able to stop the disease, to stop the transmission of the virus or the bacteria, whichever you're looking at. And then the other area is quality.
There has been a great deal of misinformation when it comes to vaccines, but this has been found to be false.
We are seeing escalating level of misinformation. And that is a big undertaking for us, because we are going to compete with anti-vaxxer with the right message. We want to see that every avenue of political interface with the population, that voice needs to be resounded over and over. We want to see that the multi-sectoral entities that are involved in this space, we coordinate more and we integrate more.
Uganda has 13 antigens currently in the routine immunization schedule and has introduced the 14th antigen, the malaria vaccine. New vaccine will continuously be introduced to ensure that the future generation is protected from vaccine-preventable diseases.
Vaccines remain one of the most cost-effective and impactful tools in public health. On behalf of the Ministry, I would like to reaffirm our commitment to achieving our vision by 1. Expanding access to vaccines, including new and innovative ones like the malaria vaccine. 2. Strengthening community engagement to build trust and counter misinformation. 3. Enhancing surveillance and outbreak response to rapidly address vaccine-preventable diseases. And 4. Ensuring every child is vaccinated so that we eliminate the zero-dose children.
Routine immunization is more than just a health intervention. It's a lifeline for children and families. In Uganda, it's a story of hope, resilience, and the power of communities coming together. But the work is not done. Together, we can ensure that no child is left behind, because every child deserves a healthy start in life.